Hello. Today we're going to talk about knee arthritis. The knee joint is actually bone, which actually has a lining called cartilage. Over time, cartilage tends to weaken, sometimes flake off, revealing the underlying bone or subchondral bone. That leads to arthritis when that lining disappears and the bone begins to rub against bone, and it becomes very painful. Oftentimes you'd like to treat this initially with conservative measures such as anti-inflammatories, modification of activities, physical therapy, and occasionally injection. When steroid injections no longer work, another option would be viscosupplementation, which is a lubricant type injection that we actually inject into the knees in a series of 5 shots. If all of these measures fail, then the other option would be a total knee replacement. There have been many advances in total knee replacement over the last few years. Now we can actually give you a custom knee, whereas previously a surgeon had to rely on standard tools that were made for a one-size-fits-all type of procedure. Nowadays we can actually take an MRI of your knee, look at your body anatomy and your alignment from your hip, knee to your ankle joint, and send that MRI to a manufacturer where they actually manufacture custom jigs that allow us to map your knee and place the implant accordingly to your anatomy. We are hoping that this will actually increase the longevity of total knee replacements past the current expected outcome of about 15 years. So basically, once we get the MRI out to the manufacturer, we receive models of the knee. In addition to the model of the knee, we receive these jigs. These are the custom jigs that are made accordingly to the patient's knee. So these fit on the patient's knee during the surgery and fit on the arthritic spurs and all, and allow us to make our markings and our drill holes accordingly. So when we make our cuts, these cuts are being made and adjusted towards your anatomic alignment. So this is for the femur, and this is for the tibia. So you have one for either side of the bone. Femur and tibia look like this. And you flex and extend the knee. Once we make our appropriate drill holes here, that allows us to make our cuts regarding the knee replacement and then put in the implant. The total knee implant is basically constructed of stainless steel as well as a polyethylene implant. This allows you to have adequate glide with flexion and extension of the joint. Whereas before you were having bone fragment or eroded bone rubbing on eroded bone, creating pain, now you have a fluid motion resembling that of a normal knee.